Are we rolling?
Take your time.
No.
I got all night.
Okay. So with the setup, I have the paper towel underneath the foot. I have extra paper towel where I set things that I'm using, and I have another paper towel over here that I just throw my garbage and stuff on to clean it up afterwards. Because we're trying to keep a clean technique so that everything is on its own little field. So, we are washing the foot before we do the bandage. We've got the skin cleaner. There should be enough for tomorrow, and then there's a package coming for the rest of it. So, yeah, that's where we're at. And so, I'll just spray it. Again, extra thing here just to control. And the purple is normal. It's to help prevent fungal infection, and they said don't scrub it off. So,
She called what, like Genesian violet or something.
okay.
Genesian violet, I don't know, you know.
Gin
One of those
juice.
G things that sounds almost like a J.
An Italian purple.
Yeah, that could be.
Yeah. And so just looking, making sure for any sign of infection would be red, angry, pussing, any sort of that stuff. Foot's looking good.
Yeah.
And then we have to dry this really good. Just using this washcloth as well. And I'm going gentle. Dad's got neuropathy, so he can't feel it anyways most of the time, but I still try not to cause pain. It's a little bit easier when you can't feel it, I guess.
Yeah. I point that out to everybody when they say, how does, you know, any pain in your foot? And I say, well, I got
Never
really
has
bad
been.
neuropathy, so I don't know.
Okay, and just to make sure you're actually recording, so we don't have to go through this again. Yeah. Okay.
That's the see one, do one, teach one.
Yes.
Yeah.
And so we're just making sure to get this really dry before we put on the bandage.
Yeah. Or how my dad learned to do an appendectomy.
All right. We got the little cup and the iodine. A little bit of iodine in here. This is the 3x3 inch. There's a lot of different sizes. 3x3 inch gauze pad. There's a lot of different sizes, and you can also cut it. We are soaking and then wringing it out. If there's a lot on there, it soaks through the bandage, so we
And
want to make
scares
sure
people.
and scares people.
That's one of the things you generally don't want when you're sitting in a rehab room and one of the workers comes in, looks at your foot and goes before.
All right, and
Not a good
Checks
sign.
for all the important parts real quick.
looking over.
I just about called the sign of the cross not a good sign.
It is usually not a good sign when
Stopped
Don does
myself
it.
just in time.
All right. So now we
Depends
have.
on what side of the fence you're on, I guess.
There's a bunch of these too. The gauze bandage rules.
You need to show that a little better.
Gauze bandage rule.
Okay, there you go.
Okay. So
Yeah, that's perfect coverage. You gotta get the iodine up on the top where the toe is, and you don't want it so soaked. That's perfect.
yep. So I do a figure 8 wrap to get this on here. However you put this on, just make sure you're not going around in a tight circle. So I start up and come across, and then I'll work my way around here, and I'll get that toe in a minute. Of course, now it's not going to turn out perfect because
doesn't.
You
we got
started
the
from
camera.
the other side, and you usually start up
I
at
know
the
it doesn't
ankle,
need
and
to
you
be
should
perfect.
go with what
You're
you
doing
know, because everybody does it their own way,
Yep.
and as long as they do it so it crosses up top
Yep.
the ankle,
Secure,
it's been
covered.
fine. Remember that nice, competent home nurse from Benedictine said you were competent, so just, trust yourself. I suppose in the final analysis, if Johanna gets cold feet, she can drive up to Proctor and get you
There we go. There's your backup. You
plan.
can
It just occurred to me.
you can just go get Jeanette each day to do this too. How about that? I think that's an excellent idea.
That's not a bad idea at all.
Yeah, I don't know how Jeanette would feel about
Yeah,
it.
somebody should probably ask her.
Ask her first. Yeah, before we just rope her into this.
She'll do it.
Or Joe, just tell her you need some help.
Yeah.
Call up and go,
See
hey,
how that
please
goes.
to do it.
But we have lots of supplies, so if you need to redo it, just go ahead and
Okay.
redo it. That's not an issue at all. Like,
Oh, tape still.
take two.
Oh, tape still.
Oh, okay. There.
Yeah, some people put
Yeah, redo
4,
it. I
5,
did not
6
hit
pieces.
record.
Some
That is
people
my
put
bad.
One piece of tape on
So sorry.
We're done. What did I just do with the tape? Let me just like bang it.
Is it
Okay.
right there next to you?
Oh yeah, I can't see all this white on white on white over here. It's like winter. Okay.
And then the tape is just to secure the loose ends.
Yep.
Yeah.
And then of course, you know what we didn't grab is I put a grippy sock over this when we're done. Oh come on.
We don't need video for that.
Yeah.
Yeah. Anybody can.
Find a grippy sock and put it on.
I can put a grippy sock on.
This is very true. These gloves
How
and
do
this
they-
tape.
how
There we
do
go.
After all these years of technological development, how have they not come up with a tape that doesn't stick to the average medical professional's glove?
Or just perforations like it's paper towel.
It has
can pull off
little
perforations.
chunk.
It does though. Look at.
Oh.
Okay. Oh no. Okay. Okay. So this is our wrapped foot, and there it is.
Ta-da!
Ta-da! I think that covers everything.